All right, in this video, we are going to be taking a look at the femur. There's quite a lot of structures on the femur, as you can see, about 30 of them. So I'll try to go as fast as I can. Again, this is really just about labeling your notes, which are on anponline.com, more than actually really appreciating what the structure looks like. We'll focus on that when we do our the model videos. So let's start with the head and neck of the femur. Color the head in yellow. I'm a little envious of you guys because it's no fun labeling these on the computer. I have good memories of labeling these in anatomy. You're probably rolling your eyes because this is no fun for you, but it is kind of nice to do some art, if you want to call it that. Certainly not art for me right now on the computer. Okay, there is the head. The Fovea Capitis, if you remember the fovea on the radius, it was on top of the radial head. It's the same case here in the femur. We really can't see it because we're looking at it from the side. Well, I should rephrase that. This is a posterior and an anterior view, but the Fovea Capitis is pointing medially, so we can't see it, but it's right in the dead center of the head and it looks like a little divot. So we'll take a look at that model. Just like the humerus, the femur has a anatomical and surgical neck. It is. I've had I was fortunate enough, I kind of say fortunate enough, almost joking, because it was somewhat of a traumatic experience, but no, it was really interesting. I was fortunate enough to see a hip replacement at what hospital I was at. I think I was at Enloe Medical Center in Chico, California, up north. And I got to watch a hip and a knee replacement and a couple other surgeries. And man, it is just traumatic. It is brutal. It's like the power tool aisle of Home Depot. You just have saws and drills, and it's pretty crazy. I'm sorry to tell a story in this video, but I'm going to. Really quick, I just have to tell you about a hip replacement. Fast forward like 5 minutes if you don't care. Um, so watching a hip replacement, I think they had the patient in sideline, and they've exposed the head of the femur and the acetabulum, and they're trying to dislocate the femur. They're trying to pop it out of the acetabulum. And the acetabulum is a pretty deep structure. It's very congruent with the head of the femur. The femur doesn't just slide out. So they have to puncture the joint capsule, and they have to do some other things, and basically forcibly internally rotate the femur until it pops out, and it just makes that like classic sound, like a type of sound. Sorry if I just hurt your ears, but it was it was traumatizing, and then it got a little bit worse. Picture a steel ball about the size of a tennis ball, and then picture that cut in half. So it's a hemisphere, steel hemisphere. That was on a drill, so it's basically a drill bit, a half sphere drill bit. But instead of being smooth on its exterior, it almost had scoops on it like a cheese grater. And so they would spin that around and bore out the acetabulum, which is here, to make it a perfect hemisphere for the new prosthesis that was about to go into it. Oh my gosh, I am going to do my best to never have surgery. Anyway, why am I talking about that? Oh, anatomical neck. Yes, that was my tangent. So here's the anatomical neck. If there's an anatomical neck, then that means there's probably also a surgical neck. So number 10 is a surgical neck. Surgical neck, they say it's right here. Honestly, just so you guys know, the surgery that I saw, more like this. But anyway, let me erase that. That's the location of the surgical neck, or those dotted lines. Better. Okay, so let's name the trochanter. There's only two trochanters in the body, and they're right here. A trochanter is a big tuberosity. So the tubercle is kind of the smallest muscle attachment. A tuberosity would be in the middle, and then a trochanter is a very big muscle attachment. So let's go ahead and label the greater trochanter here. In the posterior view, we can see most of it. There is the greater trochanter. We can see it as well. Oh, I'm sorry. That's yeah, no, that is in the anterior view. We only see a little bit of it right here. You can feel this if you put your hand about where you think your hip is. Some people mix up hip and pelvis. So hip is the joint between the head of your femur and acetabulum. That is, I wish you guys could see me, but that's the most lateral aspect. Like your proximal thigh, lateral proximal thigh. Your pelvis is more what we think of as our waist. Like when you say I'm putting my hands on my hips, or that like you know the gesture of someone putting their hand on their hips. They're actually putting their hand on the wing of their ilium. The hips are a bit lower, but anyway, you can feel the greater trochanter. A lot of times, if you're a runner, long distance runner especially, that can become pretty sore. There's a bursa between it and your IT band that can. Well, what color did I color? There we go, green. All right, lesser trochanter, we will use orange. You can only see a little piece of it from the anterior view. Here it is in the posterior view. I kind of probably overdrew it. Oops, I didn't mean to erase the whole thing. It's really just... Okay, and that is a lesser trochanter. The intertrochanteric line, that is not to be confused with the intertrochanteric crest, so two different things. The intertrochanteric line we see from an anterior view, and it's not very well defined. I'm just going to draw a straight purple line like that. That should be straight. It's a mouse, sorry. That's a tougher one to tag, but do know it's anterior. So if you see a line between the two trochanters, that's going to be the intertrochanteric line. If you're looking from an anterior view. If you're looking from a posterior view, there's a good chance that you're actually looking at, I shouldn't say there's a good chance, you are looking at the intertrochanteric crest. And that is very visible. So when we look at the model, you'll be able to see that intertrochanteric crest from the posterior view. The intertrochanteric line is from the anterior view, and it's less well defined. The next structure, trochanteric fossa. This is a very cool structure to see on the real bone. It's like a little cave or tunnel inside the bone. I have to draw an arrow because you can't see it. There is a just perfectly circular hole right there, about, I don't know, about a centimeter deep. And we call that the trochanteric fossa. You have a muscle that attaches to that. Obturator internus, actually, the muscle we were talking about earlier, attaches to that and rotates the femur. I apologize, guys. I haven't been up with color coding, so just make sure you label these. Quadrate tubercle. Quadrate tubercle, I'll just draw a little X. But I'll just draw a little X because there is a pretty pronounced tubercle right there called the quadrate tubercle, and quadratus attaches there, which is a external rotator of your hip. All right, let's go on to gluteal tuberosity. This is a gluteal attachment. It's right here, this roughened area. Gluteal tuberosity. Let's skip pectineal line, spiral line. Oh, I mean, we can see it on the model. No, it's fine. We've got enough. Let's go ahead. We'll skip those. And that's it for the proximal end. For the shaft, um, here's the deal. The shaft. I'm gonna just label this really quick, but don't freak out. I'm gonna go kind of quick. We have three structures here. Here, this, and then we have this middle. It's hard to draw. So that's a combination of the spiral line, the pectineal line, the posterior border, I guess the crest, I suppose. Rather than label those all as individual structures, I just want to address common crests that the three of those structures form right here. Wish I had a real femur, but we'll see it in the model in a second. As this whole middle ridge, which we'll see on the model, we'll call the posterior border. We'll just keep it simple. So 14 in purple, we'll just call that the posterior border. And you'll see that. Don't worry about the medial, intermediate, and lateral lips. That's what I was showing you there with three different lines coming together. Medial and lateral border. So you know you're on the medial side because the femoral head points towards you, towards your body. The greater trochanter points out, which is why you can feel it on the side of your hip. So that would make this the medial border. And then again over here is the anterior. It's the medial border. And then let's do the lateral border. And you can label this on this little triangle cross section here as well, if you'd like. The femur has a posterior border pointing backwards and then a medial and lateral border. It has an anterior surface and a medial and lateral surface, which we will, I don't want to color those in because it's just going to it's going to be a mess, but let's write them here, I guess. Anterior surface. This would be medial surface because we're referencing this bone right here, this anterior. And then lateral surface, posterior border, lateral border, medial border. Okay, three borders, three surfaces. Distal end. Like the humerus, which is kind of the counterpart of this bone in the upper extremity. So like the humerus, we have a medial and lateral supracondylar ridge. So this would be the medial supracondylar ridge. And this would be lateral supracondylar ridge. All right, the popliteal surface, your popliteal area, by the way, is just the area behind your knee. It's like your knee pit, I guess. So we can label that all here. This is all popliteal area, or I'm sorry, surface, popliteal surface. That's all popliteal surface right there. Adductor tubercle is pretty pronounced. You can see it pretty well usually. In the picture, it's this little point right here on top of the medial condyle. Our adductors are what pull our knees in towards midline. Like imagine if you're trying to squeeze a water bottle between your knees while you're driving or something. You shouldn't be doing that, I guess. But you would be using your adductors. Some of them attach right there. So that's adductor tubercle, which brings us to our condyles. So we'll do our, I wish I had colors. We'll do our medial condyle. I guess we'll just call it. So here's our medial condyle. There. From this side, it's a little bit tougher, but it's this area. I don't want to color that in because we're going to end up labeling it something else. So let's just do it from the back. So this would be our medial condyle here, and our lateral condyle They don't have special names like the condyles of the humerus, which we call trochlea and capitulum. They're just called condyles, medial and lateral. And then, of course, when we have condyles, there's almost always seems like there's a epicondyle, and this is no exception. So there's an epicondyle here, and that would be the medial epicondyle, and then there's an epicondyle here. All right, popliteal groove. We need a side. So we will look at that on the model. There's a muscle called popliteus that sits right in there. I'm just so you guys know where it is. From a posterior view, it's going to be right here because it's on the lateral side. It's on the lateral condyle. You know what? I should do a different color. Black. Oh my goodness. You guys saw me click black, didn't you? Let me try this again. Boom. All right. So popliteal groove is lateral. We'll get a much better picture of it on the model. Intercondylar fossa. That is in between the two condyles from the posterior. So right in this area. Intercondylar fossa. And then something has happened here. There should be a 30. So right in a 30 and right in patellar surface. That's why I didn't color this earlier. That's the patellar surface. That's where your patella sits. The patella is actually really interesting. It could actually be quite high when your leg is straight and then quite low when your leg is flexed, when your knee is flexed. It moves quite a bit up and down. But anyway, there's a lot of articulation right there specifically. So we call that the patellar surface. And while we're at it, I just had some coffee, so let's do the patella. Typically, the only question I ask about the patella is left or right. There's only 3 structures on it, so the base is just the top, the flatter area. I could just say this side is the base, and then this point is the apex. And then, what is going on here? Number 4 should be lateral facet, and 3 would be medial facet. So typically all I'll do is just ask, is it a left or a right? And what you would do to figure that out is in lab, if we were in lab, this quarter we're not, of course, you would set the patella on the table facing away from you with the facets here facing down. It will always fall to the side it is. So if it falls to the right, then it's a right patella. If it falls to the left, it's a left patella. And the reason it does that is because the lateral facet is bigger than the medial facet. So even without being able to physically hold it, you can just look at it and say, okay, this lateral facet is bigger, so this is a right. Right? If we balanced it, remember this is a posterior view, so we'd be this side would be face down on the table. So if we set that down on the table with this apex pointed away from us, you know, here's the fulcrum, it'd be balanced on it, would fall to the right because the lateral facet is bigger. Anyway, so I'm feeling good, guys. So I mean, you could always pause and then go to the next lesson on anponline.com and watch the femur video, but I'm going to keep coloring. So, oh boy, there's a lot here. I should reconsider. No, let's do it. All right, so for the condyles, just so I don't make this all messy, I'm just going to do it that. Okay, that whole area on both sides, right? So let's do it like let's do it like this. So this it would be both of these, right? Would be number 1 because these are both medial condyles, and then on the outside is lateral condyles. So let me slow down and explain what views we're looking at. So We're looking at an anterior view of a right tibia. So your tibia is your primary weight-bearing bone in your lower leg. If you've ever kicked your shin on something, you're kicking the anterior border of your tibia, and that's not very comfortable. Also, you may, on the inside of your ankle, there's that little inconvenient lump of bone that tends to get hit on coffee tables and things. You have one on both sides, inside and outside. This one on the inside right here, let's just label it so you don't have to guess what I'm talking about. Right here, it's called your medial malleolus. So that clues you in that this is medial. So if you're trying to figure out lateral and medial condyle, find the medial malleolus and say, oh, okay, these are the medial condyles. These are the lateral condyles. So on the left, we have an anterior view. On the right, we have a posterior. So anyway, so we've labeled 1. Let's label 2 as well. 1. All right, tibial plateaus. So let's label the superior view of the tibia. So orange is medial, green is lateral. Couple ways you can tell medial from lateral. Number 1, this is pointing forward. And I know that all of our bones in the notes are right, so I can just automatically say this is medial and lateral, but a practical way to know is that the medial tibial plateau is always bigger. Your medial meniscus is bigger as well, and that's why. So those are your tibial plateaus. Those are where your femoral condyles sit. They rest on that. So when you're standing up, all of the weight above your knees is sitting on those 4 tibial plateaus of your 2 tibia. Is bigger than the lateral. There's an area in between that emanates, I guess you could say. They think so because they call it the eminence. Right here, the intercondylar eminence. So I'm going to label that with a 5. Label it here as well. You could also label it here, but I believe we might be labeled. Let's see. Yeah, there's some tubercles there that we're going to label, so I don't want to gum it all up. So let's just write 5 there to say label. Then we have the medial and lateral tubercle. So here is the medial tubercle of the intercondylar eminence. And here is the lateral tubercle of the intercondylar eminence. And you could do it here as well, right? So there's lateral. There's lateral. And let me go back to yellow. There's medial. Not yellow yet, come on. There we go. There's yellow and there's yellow. So those are your medial and lateral tubercles of the intercondylar eminence. Those are actually attachment sites for your ACL and your PCL. We'll talk all about those when we get to the articulations chapter and lecture. That brings us to our anterior intercondylar fossa. So there's that word intercondylar again, because we're in between the condyles. There it is, anterior intercondylar fossa in purple. And then let's do blue. And that's posterior intercondylar fossa. All right, tibial tuberosity. Guys, I don't know if you can tell, but I got a new microphone. I hope it's okay. What I've found though is that I have to pay a lot more attention to talking right at it. It seems to be more sensitive to that. So if I'm getting louder and quieter, I apologize. But the reason I did it is because I'm in school right now as well. I have my clinical doctorate, but I'm getting my academic doctorate, a PhD. And I'm on all these Zoom meetings, and the audio is so bad. So I thought, you know what? That's probably how I sound too. So I bought a new microphone. I hope it sounds good. Tibial tuberosity is right here. Sorry. You've surely hit this on something and been very mad at it. That's just atrocious. Let me try that again. You guys can see the outline here, though, I think, I hope. There it is right there. Tibial tuberosity. Fibular Fassett. So Fibular Fassett is always going to be lateral because the fibula is lateral. You have another bone in your lower leg called the fibula, and it's right here. Now it's really cool looking and easy to see on a real tibia. So unfortunately, we won't get an opportunity to do that. But hopefully, you guys all stick around for next quarter, because our lab is amazing in person and you will enjoy it. And we can pull out some bones and stuff too if you would like, but it will be nerves and blood supply and organs and stuff next quarter. I mean, I guess there's always a possibility we're still not in session, but I really hope so. We still have a month or two for things to calm down. Anyway, sorry for the tangents today. Fibular Fassett. Okay. Now let's do popliteal area. This is an easy one to mix up because remember, there is a popliteal surface on the femur. So that is a bit of a challenge to remember that the tibia has an area and the femur has a surface. But anyway, it's this posterior area, kind of like the back of your knee pit, popliteal area. Soleal line. Soleal line. There's a muscle called soleus that attaches right there, which is why we call that the soleal line. Our next structure is the groove for semimembranosus. I know, this is a long lab, you guys. This will be the hardest quiz, I imagine, so hang in there. But it's right here. It's a really nice groove. When your knee flexes, there's a tendon that sort of sits in there. It's one of your hamstrings. It's called semimembranosus. The next one, I'd be willing to wager that I will not put on a quiz because it's not actually visible. It's just this idea. Well, it's not an idea. It's I'm not going to draw it on the bone, but basically you have an attachment on your tibia that looks like this. It looks like a question mark, two lines next to it. That kind of looks like an ear. Anyway, there's three muscles that attach to that. Semimembranosus, gracilis, and sartorius, gracilis, and semitendinosus. Anyway, not important for you to know. Well, it may be, but I won't be quizzing you on it because I would have to draw those. I'd actually have to draw the attachments and then ask you to name one of them. And that, I don't know, I won't be doing that. So anyway, it's called pes anserinus because it looks like a question mark. So that's what pes anserinus means. Anyway, just so you know what it is, you can cross it off though. The next structure is Gerdes Tubercle. Gerdes Tubercle. It's right here. Right there, Gerdes Tubercle. And that is it for the proximal end, you guys. So good job. Let's look at the shaft. I know you guys love looking at these borders. So we know that the tibia has a sharp anterior border because we've hit it on stuff. It's our shin. Anterior border. Medial border. And lateral border. If you guys want to label those, I'm not having a lot of success with this mouse, but well, let's just do it. All right, so that's your anterior border. I think you can see the line that I'm trying to trace and do a better job than me, hopefully. There's the lateral border. And here is the, drumroll, medial, oh boy, medial border. So those are our borders. And I think by this point you guys are old pros at surfaces, but let's do it. So say it with me. No, I'm kidding. But what is that? That is the medial surface. This would be lateral surface. I don't have room to write it, but if you want to write LS, and this would be posterior surface. So when I took anatomy, there was a lot of effort that went into remembering which bone had which. You know, the tibia has an anterior border and no posterior border, but the femur has a posterior border and no anterior border. There's a lot of memorization that went along with that. I think it's just a whole lot easier to look at the bone and decide what it looks like. I mean, when you look at the tibia, it's a triangle. The shaft is a triangle prism, right? It's a three-dimensional triangle. And it has a sharp border pointing forward. So that's just, it's obviously an anterior border. And then it has a flat surface pointing back. So that's obviously a posterior surface. The femur is the exact opposite. So I would focus more on just learning what the bones look like, learning what the structures look like, and if you can, buying that 3D for Medical Essential Anatomy app that I use, and practicing with that. And I would just focus on that. And I think the borders will come kind of second nature. So. And I don't you'll see some border questions on quizzes and tests, but not a ton. Okay, so the last structure we have on the shaft is the vertical line. And that's what it is. It's a vertical line. That, what I drew isn't one. Oh, that's gracious. Here we go. Vertical line, right there. Sort of vertical. Let's go to the distal end. I think I should have stopped at the femur. I'm getting flustered. Okay, so distal end, we already labeled medial malleolus in yellow, right there. That's a real obvious good structure, good landmark to help you orient yourself. And then this is the part I'm going to skip. So at some point, the tibia goes from being a triangular prism to being a rectangular one. It's a column instead of a triangle. It has four sides. That's actually 5 surfaces if we count the bottom one. So that gets confusing. I mean, it's not that. So this would be the anterior. You don't have this. This would be the posterior surface, and then there's a medial and a lateral. And then at the bottom here, there's a flat surface called the inferior surface. I won't be asking about the quiz, but they're there. Now you know. I do want to label the fibular notch, however. So let's use, I guess, light blue. And right here, there is a notch for the fibula. And that makes a lot of sense. If you think about the fibular facet in here. So what we're going to learn on the next slide, I'll go there right now, is that the fibula articulates both superiorly and distally, or inferiorly rather, with the tibia. And it does so at the fibular facet and fibular notch. So it makes sense that they're on the same side. So both of those structures are lateral. And then the last thing it looks like on your notes is the medial malleolar facet, which is right here. One of the bones of your foot sits in here. That's the main articulation between your foot and your leg. And it's called the navicular. It's called the talus. And the talus articulates both with this inferior surface as well as the medial malleolar facet. And you can label it here as well. It's on the inside of the medial malleolus. And you guys, you did it. You survived another coloring guide. I think it's time to look at the 3D model for a little bit. Thank you.